Welcome medical students and enthusiasts to an intriguing journey into the world of gastrointestinal diseases. Today, we present to you a series of medical mysteries that will test your diagnostic skills and knowledge. Through 3 engaging cases, you'll be challenged to identify various gastrointestinal disorders based on detailed patient histories, symptoms, and clues. Our goal is to make this experience interactive and thought-provoking. Each case will provide you with enough information to make an educated guess before revealing the final diagnosis. Along the way, you will not only sharpen your diagnostic abilities, but also reinforce important learning points that are crucial in the field of gastroenterology. So, put on your detective hats, gather your medical tools, and get ready to solve these gastrointestinal mysteries. Remember, attention to detail and critical thinking are key. Let's dive into the first case and begin our diagnostic journey. Meet John, a 45-year-old construction worker in good health. Recently, he's had a persistent stomachache that's getting worse. The pain is a dull, gnawing sensation in the upper abdomen. It worsens at night, waking him from sleep.
My appetite has decreased and I feel nauseous after meals. I've lost about 5 pounds in the past month.
John appears slightly pale and tired. He winces when you palpate his upper abdomen. John's medical history is unremarkable. He has no known allergies and does not smoke or drink excessively. He occasionally uses over-the-counter pain relievers for minor aches and pains.
I'm not sure about any family history of gastrointestinal issues. John often skips breakfast and has irregular meal times due to his work schedule. His diet mainly consists of fast food and convenience meals. My symptoms include persistent upper abdominal pain, nausea after meals, and unintentional weight loss.
To aid your diagnosis, consider these clues. Pain location suggests an issue in the upper gastrointestinal tract. Worsening pain at night and relief with food are signs of peptic ulcers. Absence of jaundice and normal vitals rule out severe conditions. John's use of NSAIDs could contribute to his symptoms.
So, what do you think it could be, Doc?
You order diagnostic tests, including a CBC, upper endoscopy, and Helicobacter pylori test. You explain the importance of these tests to John. He agrees, eager to find relief from his discomfort. After reviewing the test results, you find that John has a positive Helicobacter pylori test and signs of a peptic ulcer. The diagnosis: peptic ulcer disease caused by H. pylori infection. The main causes include H. pylori infection and prolonged use of NSAIDs. Treatment involves antibiotics, proton pump inhibitors, and lifestyle changes. Follow-up appointments are recommended to monitor progress.
Hi, I'm Sarah, a 32-year-old graphic designer. I've been experiencing persistent bloating and abdominal discomfort for the past few months. The bloating is often accompanied by excessive flatulence and a feeling of fullness even after small meals. The discomfort feels like a crampy sensation that moves around my abdomen. Sometimes it gets better after a bowel movement. Occasionally, my stools are loose and watery, but there's no blood or mucus. I haven't traveled recently or used antibiotics. My weight is stable, but I feel constantly fatigued and have trouble concentrating at work.
During your examination, Sarah appears anxious and slightly distressed. Her abdomen is mildly distended, but there are no palpable masses. Bowel sounds are active, and there is tenderness on deep palpation, particularly in the lower abdomen. Sarah mentions that her symptoms often worsen after consuming dairy products or large meals. Sarah's medical history includes occasional migraines and seasonal allergies, but no significant gastrointestinal issues. She has no known allergies to medications and does not smoke or drink alcohol. Sarah follows a vegetarian diet and consumes a variety of plant-based foods, including legumes, grains, and vegetables. She drinks coffee and occasionally consumes dairy products, although she has noticed an increase in symptoms after doing so.
My symptoms include persistent bloating and abdominal discomfort, excessive flatulence and a crampy sensation, occasional loose and watery stools, and fatigue and difficulty concentrating.
You consider several possibilities, including irritable bowel syndrome, lactose intolerance, and celiac disease. To narrow down the diagnosis, you ask more detailed questions about her diet and symptom patterns. Section 8, Case 2, Additional Clues and Hints. To aid your diagnosis, you consider the following clues.
1. The variability of symptoms and their improvement after a bowel movement are characteristic of IBS. 2. The worsening of symptoms after consuming dairy products suggests lactose intolerance. 3. The absence of weight loss and severe symptoms helps rule out more serious conditions like inflammatory bowel disease or celiac disease.
You decide to order a few diagnostic tests, including a lactose tolerance test to check for lactose intolerance, stool studies to rule out infections or other causes of diarrhea, and blood tests to screen for celiac disease and assess general health. You explain to Sarah the potential causes of her symptoms and the importance of these tests in reaching an accurate diagnosis.
I agree to proceed, hoping to find a solution to my persistent discomfort.
Section 9. Case 2, Diagnosis and Explanation. After reviewing the test results, you find that Sarah has a positive lactose tolerance test indicating lactose intolerance. The diagnosis lactose intolerance leading to her gastrointestinal symptoms. Lactose intolerance is a common condition where the body cannot digest lactose, a sugar found in milk and dairy products. Symptoms typically include bloating, diarrhea, and abdominal pain after consuming lactose-containing foods. The condition is managed by reducing or eliminating lactose from the diet and using lactase supplements as needed. You advise Sarah to follow a lactose-free diet and provide resources for lactose-free alternatives. You also discuss the use of lactase supplements for times when she may consume dairy products. Sarah is relieved to have a clear diagnosis and is eager to make dietary changes to improve her symptoms. Section 10, Case 3, The Unexpected Weight Loss. Meet Michael, a 60-year-old retired teacher. He comes to your clinic concerned about unexpected weight loss. Over the past 6 months, Michael has lost 15 pounds without trying. He also reports intermittent episodes of diarrhea and abdominal cramps. Despite a healthy appetite, he feels fatigued and has low energy. During your examination, Michael appears thin and slightly pale. His vital signs are stable, but his abdomen is soft with mild tenderness.
My medical history includes type 2 diabetes and hypertension, both of which are well controlled with medication. I have no known allergies to medications, and I don't smoke or drink alcohol. I follow a balanced diet and exercise regularly. There's no family history of gastrointestinal diseases, but recently I've been experiencing some troubling symptoms. I've had unintentional weight loss of 15 pounds, intermittent diarrhea with loose, greasy stools, abdominal cramps, and urgency. Plus, I've been feeling really fatigued and my energy levels have declined.
You consider several possibilities, including malabsorption syndromes, chronic pancreatitis, and celiac disease. To narrow down the diagnosis, you ask more detailed questions about his diet, bowel habits, and any other associated symptoms. To aid your diagnosis, you consider the following clues. 1. The combination of weight loss, greasy stools, and fatigue suggests a malabsorption syndrome. 2. The absence of severe pain or jaundice helps rule out acute pancreatitis or liver disease. 3. The worsening of symptoms after consuming fatty foods points towards issues with fat digestion or absorption. You decide to order a few diagnostic tests, including a stool fat test to assess fat malabsorption, blood tests to check for deficiencies in vitamins and minerals, and abdominal imaging to evaluate the pancreas and other organs.
I understand the potential causes of my symptoms and the importance of these tests in reaching an accurate diagnosis. I agree to proceed, hoping to find a solution to these troubling symptoms.
After reviewing the test results, you find that Michael has elevated stool fat levels and imaging results suggest chronic pancreatitis. The diagnosis, chronic pancreatitis leading to malabsorption and weight loss. Chronic pancreatitis is a long-standing inflammation of the pancreas that impairs its ability to produce digestive enzymes. This leads to malabsorption, particularly of fats, resulting in symptoms like greasy stools, weight loss, and fatigue. Management includes enzyme replacement therapy, dietary modifications, and addressing underlying causes such as alcohol use or gallstones. You prescribe pancreatic enzyme supplements for Michael and advise him on a low-fat diet to reduce symptoms. You also recommend follow-up appointments to monitor his condition and adjust treatment as needed. Michael is relieved to have a clear diagnosis and is committed to managing his condition through lifestyle changes and medication. In conclusion, these cases highlight the complexity and variability of gastrointestinal disorders. By carefully gathering patient histories, identifying key symptoms, and utilizing appropriate diagnostic tests, accurate diagnoses can be made. Each case reinforces the importance of a thorough and methodical approach to patient care, ensuring that individuals receive the most effective treatments for their conditions.